Good morning, everybody, and thank you very much for inviting me along to your workshop today. My name is Gary Phillips. I am the Regional Workforce Planning Director for the South East and Tayside, although most of our work in terms of workforce planning tends to focus on the South East, which in our terms is Fife, Lothian and Borders. Tayside occasionally get involved with us, but tend to look north of the NHS for most of their work. But as with everything in the public sector, all these boundaries are fairly permeable, and we tend to work with boards that we need to in order to do our workforce planning for a particular service or a particular issue. What I thought today is to try and give you the sort of more strategic context within which workforce planning and development occurs within the NHS, because I'm very much aware that you have colleagues who are going to look at some of the practical tools in a lot more detail today. So perhaps while I ran through this agenda, it would help you understand where we're working in terms of workforce planning with the NHS and begin to make some of the links at a strategic level between health and social services. So I'll look briefly at definitions, talk through some of the context that we operate in terms of workforce planning at regional, national and board levels, look at some of the frameworks that are around at those levels, some of the challenges, and very briefly something about my role as well. There's a danger this could turn into death by PowerPoint presentation, because in trying to prepare for this, I've put in as much as I can. Now, I will flick through some of these slides to keep within my 30-minute time slot to get some questions. But I thought it was useful to give you the slides so you can read them afterwards, or you can ask me questions about it over tea and coffee. What is workforce planning and development? What I've done here is pick a definition that was produced by the Select Committee for Health, which actually didn't cover Scotland, it was England and Wales. And it defined workforce planning and development as that bit there. I'm not going to read it out because we're all able to read as well as I am. I think the most important bit is in the bottom. That last sentence says, in the context of the UK Health Service, this process is extremely complex. And I hope that one of the things you'll learn from today is it is very complex, and you'll understand some of the complexity when we get into some of the details. They went on to define a number of components to a workforce planning, and this slide here begins to throw up some of the complexity. Because they said that the key activities that underpin workforce planning development for the health service nationally requires something around data and information on staff numbers, the training requirements, some of the demographics of the workforce, some of the developments that are happening in technology terms and in policy terms. And that in itself is huge. Even trying to find out how many people who are working for us at any point in time. In Scotland is quite difficult to try, let alone understanding the levels of competence they all operate at, what they need in terms of competence development, etc. They also point out we need to look at the future supply and demand equation. What do we think we're going to need in the future, and are we going to be able to supply that staff through some of the education provisions that we make, we put in place at undergraduate and postgraduate level, some of the training we do locally, but also about recognising we operate in an international market for certain groups of our staff as well. So we need to look at some of the supply and demand issues. We actually, I'll come on to a bit more detail, we have to produce formal public documents that are called workforce plans at board level, national level and at regional level. And they set out some of the issues around supply and demand and some of the numbers, and taking into account some of the issues around recruitment and training. We're only starting to do that, and we're getting better at it. So none of the workforce plans we would say are perfect. We were talking earlier on, it's about a 3-year time frame to get something from policy into actually operating within the NHS service at board level. They also describe workforce plans by looking at some of the funding to support workforce planning and development. And I suppose we all operate in the same context, which is particularly in Scotland. Health accounts for a significant proportion of public spend, and we've seen growth in that over the last 5 or 10 years. I think that for the next 5 years, we're not going to see the same level of growth in the public sector. In fact, it may well be that we're operating with a sort of zero increase for growth, and we'll be looking at shifting away from how we spend the additional money to making sure we're getting the return on that investment that we made over the last 5 or 10 years. In health, we commission directly education and training programmes, and I'll come back to some of those issues, but you've all probably heard things in news around the revised training for junior doctors, called the MMC, Modernising Medical Careers. A little issue that's occurring at the moment in the health service we have to take account of. We also have to pick up the workforce development activities that we need to put in place to support not only about having the right number of people we need, but ensuring they have the right levels and the right competencies to do the job. And again, that's quite a difficult, complex task to do. And also there's something about contracts and negotiating that. And again, you'll see in the press lots about some of the work that's been underway within the health service on pay modernisation, consulting contracts, the new GP contracts, dental contracts, etc. All of them have a major impact upon the workforce that we employ and how they work. So, easy agenda. And no doubt you can do the same for me in terms of social services, and you have your own list of issues there. That's another way of thinking about it, just a graphical way of the process that we employ. It's, when you look at all the text and all the books and all the guidance, they tend to come back to something quite similar to this process. Again, we are very clear that we need that strategic vision for the health service in the future before you can start workforce planning. You've got to think about what type of workforce we need to deliver the service that we need. And in our context, that's a document called Delivering for Health, which is a fairly major strategic document that sets out how we're going to deliver services in Scotland now and into the near future. And that might change come the end of this week. But that currently is the strategic document we're working to. People will be looking at the health policies of all the parties in the Scottish election. Told me that there's not a lot of difference in any of the major policies around health. So Delivering for Health is probably a key document that's going to remain next time. We then have some sort of audit around the numbers and the competencies, balance supply and demand, do a gap analysis, and those are very linked, yes. Then look at the supply side in terms of supply plan and eventually an implementation plan. So when you look at workforce planning in theoretical terms, that's usually the process is described, and it's one that is adopted within the health service at all levels. Just in terms of the context we operate in, the health service, as I said earlier on, we operate at a number of different levels. Some of the changes in the medical workforce are actually being driven by the European agenda in terms of trying to standardise medical training programmes across Europe to ensure that people can transfer across boundaries and work in different countries within Europe. So we have to think about some of the consequences of the European agenda in terms of medical training, working time directive, but actually we need to start thinking about workforce planning at all the other levels as well, down to the individual ward team and the ward manager is trying to work out how many staff she's going to need, not just now, but next week, next month, next year, and some of the competencies she requires in that team. So there's a bit of a top-down agenda that's been driven by some of these European and national strategic issues. There's also a bottom-up agenda that's driven through wards and local teams, services and into NHS boards. It's sometimes very difficult to try and match the two, because sometimes they actually conflict with each other at times, and we'll come back to some of those issues later on. And as I say at the bottom, it's competing pressures across all these levels. They don't necessarily all fit together very nicely.